You may begin and identify yourself should you wish.
Good afternoon, Mr. Chairman of the committee. I'm Professor Trevor Marshall. I have a PhD in the mechanisms of diabetes. I'm a senior member of the Institute of Electrical and Electronic Engineers and a fellow of the European Association for PPPM Medicine. I am president of California's Autoimmunity Research Foundation. I bring expertise in both the medical and wireless technologies under discussion here. Last year, I and my colleagues published a paper which reported two of our own studies. We found that human beings who have a chronic disease are extremely sensitive to the radiation SB649 would encourage. The World Health Organization's former Director General, Dr. Gro Harlem Brundtland, has publicly reported that digital wireless radiation is a hazard to public health, stating that she has no doubt that humans are being negatively affected. We have to hope that it doesn't turn out too seriously, she says. But our own studies show that a majority of people with chronic illness are made more ill by the wireless radiation, which SB 649 will permit in California's residential zones. 60% of American adults currently have at least one chronic illness. While only a small fraction of this 60% currently realize that wireless radiation is making their illness worse, this fraction is growing rapidly. It will be impossible for these individuals to avoid the radiation coming from the small cells, which will be allowed in their neighborhoods.
You have 30 seconds.
Many will be forced to move out of their homes. I understand the science, and I know that small cell infrastructure is not technically necessary for the deployment of 5G technologies. If you vote against this legislation, wireless infrastructure will not be harmed, and neither will the public health. Please vote no. Thank you.
Thank you. We will now, there will be no clapping during this committee. You may, as traditionally done in the assembly, raise your hands and you can wave them, and that signals that you are clapping. We are now going to the next witness in opposition via telephone conference, which the sergeants will administrate, and the same process.
Hello.
Hi, this is Miguel Santiago, Chair of the Communications and Conveyance Committee. Wanted to hear your testimony in opposition via teleconference. You have 2 minutes only to state your opposition. I'll remind you 30 seconds before those 2 minutes are up, in which I will ask you to conclude your comments. The sergeants, if you do not conclude your comments, will remove the mic.
I couldn't hear the last thing you said. Sorry.
Sure. You will be given a 30-second warning, at which time you'll ask to conclude your comments. If you do not conclude your comments, the sergeants will then pull away the microphone.
Okay, that's fine.
You can identify yourself, please, and begin your statement. Thank you for participating.
Thank you. My name is Jolie Andrzakis. I live in District 2, Jim Woods District, Chairman of the Health Committee. I am electromagnetically sensitive and environmentally induced illness. I have a full medical diagnosis by a neurotoxicologist for electromagnetic sensitivity, especially microwaves, and I have been receiving Social Security disability insurance since 2003. At great personal risk to myself, I decided to meet with Chairman Jim Wood at 8:30 on June 14th, which I did in the presence of witnesses. I handed Chairman Wood my medical records of my electromagnetic sensitivity in a 1998 California Health Department study, properly conducted research showing 3.5% of Californians were affected by electromagnetic radiation. This was prior to the time when there were many cell phones before wireless and smart meters. Now the figure would be at least double. I told Chairman Wood that if SB 649 was passed and any microwave transmission and its refrigerator-sized power supply cabinet were installed any closer than 1 mile from my home, I would be forced to move and would likely become homeless from SB 649. Chairman Wood dismissed the evidence I showed him. I asked the Health Committee to evaluate the proven harm caused by microwave radiation in residential areas. I was sick with brain inflammation for 1 month after meeting with Chairman Wood. I am only now getting my memory back. I hope you will please understand how serious this step is for the future health and life of Californians and children. And
You have 30 seconds.
Done. Thank you very much.
Thank you for participating.
Hello.
Hi, this is Miguel Santiago from the Communication and Conveyance Committee. I want to thank you for your participation. You are calling, well, we are calling you to teleconference you in opposition of SB 649. You will have 2 minutes only to state your statement of opposition. At 30 seconds, I will remind you that your time is coming to an end. You'll be asked to finish up your comments. If you do not finish them up, we will. The sergeants in the room will take away the microphone from the phone, and we will end it. So I want to thank you for your participation. You can self-identify and begin your statement in opposition. And thank you for participating.
Thank you. My name is Rebecca Heisler. I am a healthcare provider. My life was shattered when 17 wireless smart meters were installed outside my condo, causing heart palpitations, chest pain, arrhythmia despite a healthy heart, and insomnia and skin rashes. Over 6 weeks, my symptoms rapidly progressed until the last night when my heart became highly irregular and flatlined multiple times. I abandoned my home immediately. Wireless forced me out of my home, my private practice, losing friends, loved ones, essentially my whole life. From 2010 until 2016, I had to move 14 times. Far from cell towers, smart meters, Wi-Fi, all cause stabbing pain, cardiac symptoms, and other problems. Top cardiologists urge me to live far from all microwave radiation sources. I've spent the last 7 years alone, unable to participate in the life and daily activities we all take for granted, all due to a forced environmental hazard of unregulated growing wireless radiation. I have lived a nightmare. I am unable to work this whole time. My finances have been depleted. So far, this disaster has cost me over $1 million in loss of income, housing, and medical expenses. Shocking head and chest
You have
pain,
30 seconds.
arrhythmia, and cardiac disease appear only around wireless. SB 649 would destroy my life. Again, I would be forced to abandon a safe home. My 85-year-old parents now live with me. I am their caregiver. They will be homeless and uncared for if I have to run for my safety like a fugitive. I will have nowhere to go. Radiation harms us all. 5 of my doctors have been injured by wireless. It can kill. It is your responsibility to protect my life. Thank you.
Thank you for your participation. We appreciate it.
Thank you so much.
Thank you. I want to acknowledge 7 members in the room who are participating on this committee and establish a quorum. Madam Secretary, please